Good afternoon, everybody. We have a quorum, so I will call this meeting of the House and Human Services Committee to order. And first up, let's get moving. Senate Bill 273, Senator Burke. So if everybody will pull that, we are working off LC 336300. Does everybody have a copy of the bill? Are we ready to go? Okay, Senator Burke.
In interest of efficiency, you guys have passed this bill. Representative Lott presented it probably 6 or 8 weeks ago. It deals with the non-diagnostic laboratories being regulated by CLIA and exempting them from rules that are more appropriate for diagnostic or clinical laboratories. I'll be glad to answer questions, but I want to be cognizant of the time crunch and the large number of bills that you guys have in your committee, because I know how many House bills we have in our Health Committee.
Well, to be truthful, y'all didn't send me that many over, but we are starting to try to work them. Okay, questions for the Senator? Right? Same bill? Okay, it's the appropriate time. Representative Wilkerson.
Pass of Senate Bill 273, LC 336300.
We have a due pass and second. Is there any further discussion? Is there anyone in the audience that signed up to speak to Senate Bill 273? Good. Probably didn't want to take a chance to say anything and messing it up. So anyway, all right, we have a motion and a second. Everyone in favor of Senate Bill 273, say aye. Aye. Anyone opposed, no. Okay, Senator Burke.
Thank you, Madam Chair and members of the committee.
Okay, you know you do, Senator Burke, you do have to fill out a form and House rules, so you'll want to do that on your way back over. And who's carrying that bill in the House?
Jody Lott.
Okay, Representative Lott. Okay, thank you.
Thank
and
you.
You have to show up in our rules and be on the wall.
I've been on that wall many times, Madam Chair.
Okay, thank you. All right. Is Senator Unterman here? Okay. We're probably moving faster than. Yeah, she was. Okay. That's all right. Just stand at ease. Let her take her time. I mean, I think. Okay. Welcome, Senator. I was starting to tease Senator Burke, because he was talking about how many bills we had, and I said, well, y'all didn't send me as many as we sent you, but the nice thing about it, the two of us work together. We don't have to go through what the rules chairman went through this morning. Does I like that? So welcome to the House Committee, and we'll let you start off with Senate Bill 305. So for the committee, everybody make sure you have Senate Bill 305, and it's LC 372086. Does everybody have that bill?
Well, thank you, Madam Chairman, and I appreciate the opportunity to come before y'all. Is this thing turned on?
You have to be close.
Oh, okay. I appreciate the opportunity to come before y'all with 2 bills today, and I want to say thank you to the Health and Human Services in the House. I know many of you have many bills that are in my committee. As a matter of fact, there's 40 bills in my committee, and yesterday we moved, we had, I think, 10 bills on the calendar, and we moved 9 bills. There's 2 bills that will be on for tomorrow that came off that had some amendments. But I do have my tracking device. I've been working with Representative Price and some of your members. So we're down to about 30 bills, and we have committee meetings tomorrow, Friday, and next Monday. And fortunately, we're kind of unlike y'all. We only have an hour for meetings. So if you consider the fact that we have 40 bills and just a few days left, it's very difficult. So I appreciate y'all's patience, and we're getting through it, and we're going to get through it, and we always get through it. We just hold our head up and march on.
Keep marching.
Okay, Senate Bill 305 is a bill that you're probably very much familiar with because it came up the year before last year, and this is the Physician Orders for Life-Sustaining Treatment form, which is the Pulse bill. And I believe everyone in the room probably remembers that. It was Senate Bill 109 was enacted on July 1st, 2015. It codified that the Georgia Department of Public Health is to continue to provide and make available Pulse forms to be executed by patients and their attending physicians or their appointed agents and an attending physician. As you know, a Pulse form is a portable document that contains actual medical orders that can be followed by health professionals and reflected in patient medical charts or electronic medical charts. Senate Bill 305 simply requires that this form is to be changed. If it is to be changed, the Department of Public Health must notify the chairs of the members of the House Committee and the Senate Committee of Health and Human Services. Unfortunately, it's a cleanup bill. If this was left out last year, I had promised people that I would get it back in. I did not get it back in, so I re-promised that I would get it back in this year. So it's just a oversight to make sure that if any forms are changed, that it would come back before the chairman of the committee. It's very simple. The language is very simple, and I'll be glad to answer any questions for it.
Thank you, Senator. I have a question. I don't remember the discussion. I, of course, remember the bill because I carried the bill. What was the feeling that we needed to see this before the form was changed?
To make sure that, these forms can be very, very tenuous and very sensitive because they're dealing with people who are very sick, and we just want to make sure that it's not going off the deep end and having an agenda and oversight. It's no different than the Georgia High School Athletic Association that the General Assembly has oversight over. It's just basically knowledge and knowing what is going on, and that the Department of Public Health, while I have great confidence in the Commissioner and her staff, that it's just oversight so that we know what's going on. We worked very hard on the Pulse bill. It was a bipartisan bill. It took a long time. It's a collaborative agreement with many different organizations. And it's just a very sensitive issue when you start dealing with life and death type matters and end-of-life matters and advanced directives. It's just very tenuous, and we want to make sure that we're accurate and that the General Assembly knows what's happening out there in the real world.
Gotcha. It's like me throwing the person that wanted to talk about assisted suicide out of my office. Okay. I thought that's what it was. I just couldn't remember. Other questions from committee members? Representative Mosby.
Thank you, Madam Chair. And thank you for the bill right here.
Sorry.
That's okay. Suppose the patient doesn't have any family members available to sign this form. What would be the process at the point in time?
This has nothing to do with changing the process or the infrastructure. It's just adding additional language of what was worked on last year in the Pulse law.
Mm-hmm.
This is not changing anything. It has nothing to do with families or, if I suppose if you wanted an amendment to change, the way the current procedure is, you could do that. But this is just an oversight bill. It has nothing to do with any changes.
Okay. Other questions for the senator? Okay. We have one person that signed up. Mr. Christ.
Thank you, Madam Chair, members of the committee. My name is Johnny Christ. I'm the Government Relations Director Administrator for Georgia Right to Life. We support this bill. SB 305 is simply an oversight measure that was agreed to last session but couldn't get it in before sine die. And the bill simply requires that the Department of Public Health notify the House and Human Services Committee 60 days prior to making any changes in the Pulse form. This allows the legislature to retain oversight of the process and of the Pulse bill that is active in Georgia. So Georgia Right to Life supports this bill, and I ask for your favorable consideration.
Thank you. Okay. I think that's the only person we had. All right, we're back to the committee. What is committees, the way committees? Okay, we have a motion to pass. Okay, we have a motion and a second. Is there any further discussion? Okay, everyone in favor of the passage of Senate Bill 305, say aye. Aye. Anyone opposed, no. Okay, the ayes have it. Thank you, Senator. Okay, on to your next one, and that's Senate. Oh, House sponsor.
I believe you were going to carry that bill, Madam Chairman.
Okay. Boy, we can tell it's busy when I can't remember what I'm doing from one day to the next. Thank you for reminding me. Okay, Senate Bill 308. And we'll be working off we're working off LC 336593S.
That's exactly right. Thank you, Madam Chairman. And I appreciate the opportunity to bring something that I think is very positive. This bill came about this past summer in 2015 when there was a lot of publicity about things that were going on in the marketplace revolving around women who were pregnant and their ability to be able to get an abortion. And instead of dredging through the bad things and the partisanship of that particular issue, we decided to come up with something very positive. And that's exactly what the name of this bill is, Positive Alternatives for Pregnancy and Parenting Grant Program. As you may or may not know, in the state of Georgia, and I do know because I've visited many of these centers all over the state of pregnancy resource centers. And what pregnancy resource centers do is offer alternatives for women who are pregnant and they choose not to have an abortion, but they either choose to carry their baby to full term and they either keep their baby or they put it up for adoption. But what pregnancy resource centers do is offer the resources to make good decisions. And that's exactly what the implementation of the bill does, setting up a grant program. And if you have followed the budget documents in the appropriation process, you may know that the House very wisely put in $1 million, and the Senate agreed to that and matched the $1 million. So there is actually, and the Senate will be voting on the appropriations bill, $2 million in the budget that will be appropriated for this grant program. And when I started looking at this program and did the research on it, I started looking at other states and collecting best practices that are currently done in other states. And the states that are currently doing this are Texas, Florida, Minnesota, Oklahoma, and Pennsylvania. And when you think about $2 million for a startup grant program, that is a lot of money. But if you look at an old state like Pennsylvania, they actually put $30 million into their budget for the grant program. So it must be working, and it becomes routine operating and business practices. If you go to a pregnancy resource center, I can give you a good example in Gwinnett County. I think I have one of the best ones in the state. They look like a doctor's office. You can go in, it's just like a waiting room. You can go in and you can have an ultrasound. You can get counseling for what's going to happen to you. They have a room where you have supplies that if you don't have enough money, you can collect supplies that you may need, whether it's diapers, whether it's a car seat, or anything to be able to help your baby. So I think it's a really good thing. I can go through the bill. It sets up the parameters of how the state will actually implement it through the Department of Public Health. I did have a lot of debate on the Senate floor. I believe I had 6 amendments. 1, 2, 3, 4 amendments that were on the Senate floor. And some of those amendments were agreed to and incorporated into the bill. So I really feel like the bill has been perfected. There's about 40 centers in the state of Georgia. Some of them are very old. There's one right down here from the Capitol, the one here in the city of Atlanta, that I believe is very old, like 40 years old. I can't remember. I said it on the Senate floor. I don't want to be quoted. But it's very old. It's done a very good job. But unfortunately, if you look at the state of Georgia, and there's about 8 million people in the Atlanta regional area, but if you look, and I got criticized for calling the rest of Georgia the hinterlands. My senators have never let me forget it since the last 2 weeks. But if you go into the rural areas, you know that we have a declining population. There's about 2 million people that live in South Georgia and up in the North Georgia mountains. And unfortunately, as people are migrating more towards the urbanized areas, you're leaving these rural areas, just like with rural health care, and why we're having to do all the stabilization programs with the hospital and the infrastructure around medical care. You see that people are leaving the rural areas, and there's no profit. People are not making money because the jobs are also leaving with them. So the nonprofits, the NGOs, do not have a mechanism to be able to go out and to support their pregnancy resource centers. And that's one of the main things of this particular bill, is to give them the resources. Not only can they stay in business, but hopefully they can expand and decrease the number of abortions that we have in the state of Georgia. There's approximately 27,000 abortions each year performed in the state of Georgia. And our numbers hopefully will decrease as we're able to reach more people, because I don't believe there's a person in the room that doesn't want to preserve life and have life. That it's a better thing and for people to have better decisions, and families and women in particular, and especially young women, that they can choose better services. So I will be glad to go through the bill, and if people have questions about specific line items, like I said, we went through it meticulously, not only in the Health and Human Services Committee, but also on the floor, and making sure that when they receive this grant money, that the parameters are met, and that the enforcement of it, and that you don't overreach. You know, the biggest question when you're doing counseling, if you're faith-based, this is an opt-in program. If the Pregnancy Resource Center does not want to do it, if they feel like they're comfortable doing what they're doing, they're able to raise the money they want to raise in their community, they stay exactly like they are. But if they do opt into the program, there's certain parameters about faith-based and what you can do in counseling, because you cannot cross that line. It's a very fine line that you cannot cross when you're counseling, to use that faith initiative as a part of it. And that is written into the bill. So I would be glad to answer any questions. I know I talked a little bit too long.
Okay. No, Senator, I think you're fine. I want to thank you for bringing this bill. As you have known, since we have served together for several years, and you when you were in the House and now in the Senate, one of the things, and to the committee, those of you that are new, that I've always had a problem with, having trained in a Catholic hospital and seeing triplets born, which is one of the greatest thrills of my life. They were all born healthy. I've also tried to be realistic in following the law of the land and the parameters people put on. And one of my biggest problems has been when we only talked about no abortions, and then there was no help for a prospective mother who decided not to have an abortion, but then there was no referral to medical care, there was no support, no trying to help them get government services. We basically just left them alone. And my thing has been, if we are going to push the agenda of no abortions, then we needed to push for care of that pregnant woman, not just through the delivery process, but on through the first year and on through life, and deciding whether they want to keep the child or put it up for adoption. So personally, I thank you for this very positive approach, and it may come as a shock to some of the committee members. I am going to carry this bill because I believe so strongly in it. Okay, I have questions from the committee. Representative Peake.
And Madam Chairman, could I ask Emily Matson from the who represents the Georgia Life Alliance, who has worked with me for about 6 months now, if she could come up, because you may have particular questions about how pregnancy resource centers are run, and she might can answer those technicalities better.
That's fine. Welcome, Emily. Okay, Representative Peake.
Thank you, Madam Chair. Senator Underman, looks like you got a good bill before us. This has got a personal interest for me in particular. 29 years ago, a young, scared mother walked into a pregnancy center, pregnant, afraid, not sure where to go, what to do, what her alternatives were, and through some wise counseling and good advice from that pregnancy center, that young, courageous mother made the decision to put that baby up for adoption. And today, 29 years later, that adopted little girl is my daughter and is the mother of my grandchildren. And so I have a particular interest in seeing this bill and want to just take a point to thank you for carrying this bill because it will have a significant impact for families like it has for mine.
Right.
And so thank you, and I look forward to vigorously supporting this bill when we get an opportunity to vote for it in a minute. Thank you.
And
Representative Rand.
like you, I
Sorry.
also had 2 adopted kids, and only by the grace of God was I chosen to be a mother. And I think that's why I'm so passionate about this.
Representative Randall.
Thank you, Madam Chair. I have a few questions. The staffing and the representatives at the centers, can you tell me about their credentials, their certifications?
Yes, that came up on the floor of the Senate repeatedly, and I'm going to let Ms. Matson answer that question because she's been in the centers and knows about them, and also about the medical directorship that got brought up on the floor. But like I said, I have been in the centers, and I have worked with some of the volunteers, and some of the volunteers are friends of mine. And I'll let her answer those questions.
Most of the, well, actually, all of the centers in Georgia are nonprofits, so they provide. Is it not on? Let's see. How about it? Okay. Anyway, all the centers throughout the state of Georgia that would benefit from this grant program are nonprofits. So they're structured typically with a board of directors who oversees an executive director, and that person is usually paid if the center can afford it. And then coming down from the executive director, they have various attributes that they provide of services, both counseling. They usually have the 40 centers that the senator has spoken of are actually medical clinics. So they have a doctor whose license is on the wall that has basically created a clinic, an actual medical clinic, out of this nonprofit entity, and they supervise the services that are provided. Several of the centers have a nurse practitioner. And the key to understanding this, if there are medical services being provided, those are being performed by a licensed professional. For example, a nurse practitioner. Most of the centers that have sonograms also have radiologists that are connected that can review those scans, as well as OBs. Typically, the medical director is a licensed OB that supervises the clinic. And I do want to add, outside of those 40 medical clinics are another 30 nonprofits who are pregnancy resource centers. Y'all were provided a map I think today by Christina Twitty, that has all of the centers, both medical clinics and resource centers. And that's kind of the break apart of what the clinics have the medical doctors supervising. The resource centers are attempting to take that step up to get their, many of them actually have funds for ultrasound machines, they just don't have the funds for the technician to run them. So there'll be some, this program will increase the services that they are able to provide.
Okay, specifically to the counseling, are they LMFTs? Are they Christian counselors? Are they certified in Christian counseling? Or
I would imagine that the answer to all that would be yes. You probably have some LPCs in there, as well as I know most of the centers have their counseling aspect is volunteer. So the people that are there and available to sit down with those women facing this very, very difficult decision are people who are doing it for zero financial benefit. They're doing it because they're facing a woman who needs counseling in this very difficult decision. I've had 3 kids. I'm sure you have children. You know how difficult that decision is. Most of those people are completely not paid, and they're credentialed in whatever way the centers decided. These are not, by the way, mental health clinics.
I understand
These
that.
are open door places for Georgia's women to come.
I guess what I'm questioning is what type of counseling they would be getting, because if you have a volunteer that's a Christian counselor, I'm not sure if they will be counseling and looking at alternatives.
Well, let me point out something to the bill. The bill specifies this program is about the services that are provided. Specifically, the services that are outlined are divided from any type of counseling that would occur. The counseling in these centers doesn't need funding because it's free, it's volunteers. The services that are outlined in this bill don't have a preference for anything. They're simply an assistance to the woman.
And I understand that, but what I'm asking, I mean, whether it's paid or not, I think it's the responsibility of the center to know what type of counselors are volunteering, even though they're not being paid. But it's still important to know if the counselors are actually counseling to open to all alternatives. Are they?
Representative Randall, let me ask a question of the. Is it my understanding, and reading just on this one, and then you can go back to Representative Randall. Isn't it my understanding that anybody that comes to clinic will be provided with the booklet and the Woman's Right to Know? And does that not go into all the alternatives? And
the Woman's Right to Know booklet, which is put out by the Department of Public Health, outlines enormous amounts of information for the women, including websites and resources, everything from Medicaid to the public health department.
Which is great if they're literate, right?
Absolutely. And if they're not literate, there's a person standing there that can read it to them, unlike the abortion clinics that give this same booklet to women through the internet and don't communicate the information to them. So there's a lot more information being given person to person in this Woman's Right to Know handbook that's given out by the Department of Public Health that gives them all their options.
Okay, I still want to know, let me ask this way. Does the center set out parameters for the counselors as to how much of even the booklet they go into, or how much they talk to them about their clear understanding of their alternatives?
I think that the Department of Public Health will be promulgating the policies and the procedures, and that could be implemented within that. I think to address your question, there was a amendment on the floor. It was Amendment 2 by Senator Orrock, and they wanted to specifically state that be supervised by a licensed attending physician and employ licensed medical practitioners. And I believe that's the route that your questioning is going. That amendment was defeated because, as Ms. Mattson has said, they do have medical supervision. They do have a medical director, and I'm sure if counseling was not being done correctly. The good thing about oversight from the state is that if there are complaints, if someone was counseling incorrectly, if they did cross that fine line that I'm talking about, faith-based, and interject that faith into it, that oversight would preclude. I mean, it would have the Department of Public Health intervening, and they would be, whatever type of infractions could be placed upon them would be done. And that's the good thing. And that's why these programs in these other big states, when you look at Texas and Pennsylvania, which are larger states than the state of Georgia, 10 million people, the system works. And this system of trying to preserve life goes right along with our juvenile justice reform, preservation of families. I just testified in the non-civil duty committee a few hours ago about how do we get people that are either blood related to kids. Our society's come down to the point where we're not taking care of the kids we have. And this is part of it, and this is helping women to make better decisions. We already have the infrastructure in the state that Ms. Mattson is talking about, and this is just extending it and putting it into law and oversight that'll make it better.
Okay, finish your answer. Thank you. Representative Henson.
Thank you very much. I have some concerns and questions about this bill. I know that one of our goals is to reduce the number of abortions that we have in the state of Georgia. And I think one of the major ways that we can reduce the number of abortions is through sex education and through, protection against pregnancy. And I wonder if we're addressing that in any way whatsoever, or if we still have our head in the sand and
I'm so
not
glad you asked
recognizing
that question, because I literally put $5 million in the budget last week for public health nurses, and they do a very good job of contraceptive counseling and other alternatives. It's keeping the nurses in the clinic that is the problem, and that's why we put the additional $5 million. And anybody on appropriations, I'm lobbying you right now. Keep that $5 million in there. That's a 10% raise for public health nurses.
And thank you for that, Senator. But I want to go back to if a young girl under the age of 16 who's going to have sex, is she able to go to the public health clinic without her parents to find out anything, or does she need her parents to be going with her?
I really don't think that's applicable to this bill. This is about
Well, my
policy
concern goes
resources.
back to, of course, sex education, and
Right.
probably it going back to the schools and all. But I guess I also wonder how this affects any funding for Planned Parenthood. And are
Planned
we still
Parenthood-
funding Planned Parenthood?
Planned Parenthood is federally funded. There's no state funds that go to Planned Parenthood, so this has nothing to do with it.
There are no state funding,
No.
even though a lot
I
of
have
what they...
asked the Department of Community Health, I have asked the Department of Human Services many times, what is the state funding of Planned Parenthood, and I am told there is none.
Okay. Thank
If you
you.
can find out better, I'll be glad to get that information.
Okay. Representative Broadwick.
Thank you, Senator, for bringing this bill. I think it is a real positive solution to a problem where we've got populations that may be underserved and a good education program. And because these centers are receiving some state funding, that would not preclude a recipient from going ahead and seeking presumptive eligibility.
That's right.
Okay? That might be part of the process.
That's right.
Okay, good. Thank you for bringing the bill.
Thank you. I appreciate that.
Okay.
I forgot to mention that. I appreciate that.
Representative Peasel.
Thank you, Madam Chair. Senator, one of the first things that I ask myself when I read a piece of legislation is this the proper role and function of government, and is this the greatest use of taxpayer dollars? And I do have a concern, because while I do support these nonprofits, and I would encourage anybody to use their dollars to to support nonprofits, this is picking winners and losers, is it not?
Well, I think that's a very good question, and I would say yes, that's right, as long as the economy was stable. I was here during the recession. I was here when we cut the budget from $23 billion now, approximately. I cut it back down to $15 billion. You have to make decisions. And when you see this migration of people like we're talking about in rural areas, when you see the collapse of rural hospitals, the collapse of infrastructure, I think that is the role of government, to step in and to intervene. As a matter of fact, y'all passed a bill about tax credits for rural health care that I'm going to be hearing, I think, this week sometime. So I think when you're trying to look at the life and death and the quality of life, and you look at the matrix of our life statistics, if you look at infant mortality in the state of Georgia, we have been one of the worst in the nation. Yes, exactly. This is where government intervention should occur, because you're preserving life, number one. 27,000 abortions a year is too many for me. If I preserve one of those,
And I would argue that it's too many for everybody. I think we can all agree on that.
So I think government intervention, your question was, is this the right place? I think it is, and I believe 14 other states, or whatever number it was, have also made that decision that, yes, this is the right government intervention, and it is a good use of taxpayers' dollars.
Thank you.
I would like to add to that, Representative Peasel, that we have made it government's role to push and reduce the number of abortions and push bills that would reduce that. And if we have decided that is government's role, I think we have the right to push a role that will help people who decide not to have an abortion have a healthy child and support that child in that critical first year of life when it's so important. So we've already stepped in one area.
Madam
I think
Chairman,
we're
if
just
I
a
could
matter of
just-
stepping in the other. Representative Pack.
Thank you, Madam Chair. Lines 110 through 113, this is the section where, in order to be considered for a grant, they have some conditions that they have to meet. It says, ensure that grant money is not used to encourage or affirmatively counsel a client to have an abortion unless client's attending physician diagnoses a condition which makes such an abortion necessary to prevent her death,
Right.
and et cetera. What does that entail when you ensure that grant money is not used? Because the practical problem that I see is that once you get the grant money, some of that's going to go to overhead staff and things like that. So how would you ensure that it's not used for any purposes that encourage or affirmatively counsel a client from getting an abortion? Do you have to keep two separate books?
I think that was written as, like if you had a woman who had an ectopic pregnancy and you want to make sure that they get an ultrasound and you diagnose them and make sure that if they, I guess, needed to terminate the pregnancy because it was the life of the mother, I'm not sure. That's why that was specifically written into there.
And Representative, let me point out to you line 62 through 77 specifically lays out the services that the grant monies can be used to provide. So we anticipate once this is established with the Department of Public Health, there's going to be an interim nonprofit that will manage the grant. We're trying to keep this as small and conservative as possible as far as what's it going to take to make it happen. But when that's established, they'll line out exactly how can we make sure the nonprofits that receive the grant funds are allocating it specifically to these services. And so, and in partnership with the services being specified, then on line 118, we have a measurement of outcomes by which we'll be assessing the application of the funds and the success of their application. So I think between those two things, the department and then this nonprofit is going to guide the grant. They're going to have enough guidance as to how to make sure that that money is focused. And again, as you pointed out, not in violation of the criteria laid out in lines 110 through 113.
How did the other states do it?
They actually...
Because here's my concern about this. That language is loose enough that it kind of swallows up the rule.
Well, I think that's why you have the oversight of...
You either don't have that language at all, or just banning all use of the money that even talks about abortion or any kind of abortion services. I just don't see how that would be enforced, practically speaking.
Well, if I can, let me say this: the 70 centers that exist now, who fulfill this criteria, their standard practice would be if they have a woman who said, "I've got a difficulty here." Odds are that they don't really. I mean, if that's a diagnosis, they want to make sure that she's following her doctor's care.
Right, and that's why I was talking about the ectopic.
That's right.
But you want to make sure they're taken care of. That's the ultimate goal.
But whether they are referred for the abortion or seek the abortion, the center's not going to be involved in that because the other paragraph, the other sentences of that paragraph restrict that. That's a question about them talking with her about the issue.
Thank you. Okay, Representative Randall.
Thank you, Madam Chair. I think my major problem with this bill is that it's talking about mandates that, there isn't any counseling about abortion. It's all anti-abortion. But until abortion is illegal in this country, that's still an alternative. And if someone comes in there and says, you know what, I'm in school, my mom and dad are barely making it, I can't bring a child here, we live in poverty, I don't want to add to the cause, I'm not prepared, so many reasons. then I'm not sure if this center will counsel from that point, after that person has made their decision. What do you say about the safest abortion clinics, or where you can find one, or what? I mean, they have that right too until abortion is illegal in this country. And to me, this is only saying you can only get these funds as long as you don't counsel, pro-abortion. That's not right, because it's not illegal. Now, if it was illegal, then absolutely no grant money should go towards any counseling for or against it. But I think it's only focusing on the anti-abortion route. And there are some folks that have some real legitimate reasons that they think, because of where they are in life and their circumstances, where they feel like abortion is appropriate. Now, whether we agree with that or not as individuals, my oath of office is not to lead my 57,000 by my moral standards. It's about safety. It's about the well-being of the folks that I represent. And if I have a constituent that goes into one of these centers and they've already made this decision that that's what's best for them, then they should be given the right information. They should be counseled based on their decision and not counseled to change their decision. It's a personal decision.
Can I answer that?
Yes.
I wrote the law on the women's right to know, and you probably remember when it came through.
I do.
And I didn't bring with me, I did have it on the Senate floor, but every woman is required to give a copy of that book. And in the last 5 or 6 pages of that booklet, which is a very nice booklet that I helped the Department of Human Services draw up, very nice photography, is references in information about resources. Mm-hmm. How you go from public health, how you go to DHS. It talks about Medicaid qualifications. It talks about hospital services. So I believe whether you're going to an abortion clinic, or you're going to a pregnancy resource center, or you're going to a doctor's office, or you're going to an emergency room, the Women's Right to Know law requires that you get that book when you get your ultrasound so that you can make the right decision for you.
Okay. Well, if we're going to depend on the book, then we don't need counseling then. Just give them the book, let them read it, let them figure it out. I mean, you're saying that the information is there in the book. Okay, well, let's don't have counselors then. They don't need anybody to explain it to them. They don't need anybody to help them comprehend it. Let's do it with counselors. Let's give them the book, and whatever they comprehend out of the book, that's their life. Do you understand how lopsided that is?
Look,
Representative Randall, I think we still have Planned Parenthood areas all over our state, which would be an alternative and available if women wanted to go to them as a choice.
Madam Chairman, I found the book. It says finding the services you need, community resources, telephone helpline, safe place for newborns, medical assistance.
Senator, I'm familiar. I was here when we passed that. This is year 17 for me too. I was here. But what I'm saying is that if you're going to say, well, it's in the book, well, let's don't have any counselors, because whatever that counselor is going to tell anti-abortion is in the book too, right? I'm going to say this, and I'm going to quit, because I think I see where we're going here. Abortion is still legal. People still have choices, and it's not going to. When it was illegal, there were abortions. Now that it's legal, there are abortions. And we can keep whittling at it until it's gone, and we'll still have abortions. But they just won't be safe. They won't be in a clinic. They won't be. It will go back to the slaughtering of the days prior to legal abortions in this nation. I don't want to live with that.
Representative Randall, neither do I, and I don't believe you're old enough, but I was in nursing school when they were still illegal, and I think that since they were illegal, and since they have become legal, when they were utilized, when abortion services were utilized much more frequently. You probably are not old enough to remember, but after it became legal, if you drove down Peachtree, there was almost an abortion clinic on every corner. Not literally, but almost. That's no longer true today. Through education, through the pill, through other resources that we have. It's still the law of the land. I've said often, I think we're down to the point where you have to change people's hearts, and that's through the church, if you want to go a whole lot less. I don't think this is what this bill's about. I think this bill is about, if people are going to be encouraged not to have abortions, is getting them services that they need and help they need and directing them toward it so that they can deliver a healthy baby and either decide to keep that baby or to put it up for adoption and for that child to have a healthy start on life. And a lot of my focus is on the fact that if they're not healthy and they're premature, because women don't get prenatal care, then not only what it does to that child for the rest of their life, but we get them on later state Medicaid and with problems and learning problems in school. And I think that we can avoid a lot of that with proper help. Representative Kaiser.
Thank you, Madam Chairwoman. If my first question's been answered, forgive me, I had an emergency I had to step out for. So I have two questions. One, the healthcare services that are provided, are they provided by a licensed healthcare provider?
Yes, we went over that question, and that was amendment number.
That's done as an amendment?
No, I mean, that was an amendment on the Senate floor.
Okay.
And yes, it is. They do have license.
Okay. So my other question is, if and not at length, but could you describe what, when you go to a crisis pregnancy center, just can you walk through what happens when a woman comes there, and then if a woman does, after counseling and everything, does decide that she is set on terminating the pregnancy, then what happens? I would just like to know what they look like. And
right. Well, let me express this one more time too. We're talking about 40 medical clinics existing today, and then another 30 that are nonprofit pregnancy resource centers that hope to step up. The one in Rome, Representative Dempsey knows, they have money for an ultrasound. They just can't afford the technician at the moment. So the importance of that fact is that these are all private entities. They're nonprofit. They have their own governing bylaws. There's standards, and there's an organization called Life Resources of Georgia, which is helping them, targeting them to make them more professional, more medically capable. But they are private, and so every one of them does their process differently. I do want to stress that, and that's the beauty of this bill. For those of you who like private entities and think they can do the job better, this is a great bill for that purpose. But when a client, a woman, walks into the center, and oftentimes, by the way, there are men that are walking into these centers looking for help because there's someone that is pregnant and doesn't know what to do. There's an intake process. They decide, they offer them a free pregnancy test. If the pregnancy test is positive, and by the way, some of the centers do blood pregnancy tests because it's so early, they're trying to figure out, and maybe a urine test isn't as accurate. And that's not done unless there's a nurse present, because that's more medical. And then once that's determined, they're offered an ultrasound to determine, there's a couple of reasons they offer them an ultrasound, mainly to try to figure out further what the age of the developing child is. But the ultrasound also significantly gives the woman, we call the ultrasound the window to the womb. And so that's kind of, and then at that point, there's all the resources that they're offered in the bill, the services they can provide to help that woman in her decision.
Madam Chair, can I just follow up?
Free. Everything is free.
Okay, but would you do an ultrasound if they did a blood or urinalysis that early? Would an ultrasound still be offered?
Again, every center has a different
practice.
Okay. I know that the ultrasound option, because it is free, and I just had a baby, and ultrasound cash is, with the doctor's office is $385. At an abortion clinic, it's $200. This is free. And if a woman wants an ultrasound so she can see into the womb, she's given the opportunity.
So I'm asking the question again because I didn't get answered. If a woman does decide that she ultimately wants to terminate the pregnancy, then what happens? In the crisis pregnancy center, is she just shown the door, or is she referred to? No, I don't know. I'm asking. I don't know.
I don't know either. I mean, I'll jump on the adoption wagon here, and I have lots of adoption in my family, including my brother. And you know, that's the beauty of these centers. There's no profit motive for them in whatever they are counseling with the woman about. So I can't answer that as far as what would happen if she decides to have an abortion. She's not going to be able to get it at that center.
Okay. Last question from the committee, Representative Dempsey.
Just to clarify, and thank y'all for bringing forward this measure. I know how hard everyone has worked on it. This is a choice. This is another choice. You would not go to this center, most likely, if you had already made up your mind that you wanted an abortion. You would go somewhere else. But this allows another conversation. It empowers that opportunity. It doesn't demand it. It doesn't require it. But it just helps make sure that there is more opportunity in decision making. Is that right? Would that be correct?
Exactly right. And these are community-based services. And the impetus of the bill, like Representative Randall says, there's a divide about people who believe in abortion and people who don't believe in abortion. And these are community-based services that are resource centers. And if you're going to say no, 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 you know, at some point you have to offer an alternative. And that's where I think this cultural movement has advanced, because now we're saying not just no, 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 we're saying, well, here's some more community-based services option for you to help you make a decision. More tools in the toolbox. Getting the services where the people are. And I personally don't think that's a good thing. I think that we are moving beyond that divide of where we say we don't like abortion, and we're saying we don't like abortion, but here's something that the state of Georgia is doing that is positive. And I think that's a good thing.
If I could, one more question too, one more comment, I guess. But Senator Unterman and I serve on the First Lady's Children's Cabinet also, and we are constantly looking for all kinds of ways to strengthen the children of our state, to give them the best opportunity wherever they may be and whatever the crisis may be within their family before or after birth. So I see this as another way to continue to address that through our state. Not that it says that you cannot have an abortion. It does not say that. Right. But it does make sure that if you perhaps are in a situation where there is a mother considering the challenges of keeping a child and raising a child, and it's not possible, that would afford that conversation as well to help that life.
I agree.
All right, we have several people that want to speak. If you would do it briefly and keep your remarks made to the bill, not on what has gone on in the past in abortions or abortion clinics, but on the positive or on the aspects of this bill, either for or against it, please. Okay. Sarah Henderson, if you'll come to the podium and tell us who you are and who you're with, and we do have another rather lengthy bill, and so we'll keep the remarks for everybody short.
Good afternoon, committee members. My name is Sarah Henderson. I actually am here today as a private citizen, although I have in the past represented a client who has an interest in this matter, so full disclosure. I want to share with you a personal story about crisis pregnancy centers. So I've been married to my husband about 10 years, and about 4 years ago we decided we wanted to have kids. I went through a couple months of sort of hit and miss. Tried to call my doctor. My doctor said, "You're not going to be able to get in to see me for about 4 weeks. That's too long." So I drove around looking for some other place that I could visit. Found my local CPC, didn't know what they were about, saw a crisis pregnancy center, thought, these are my folks. Like, I need to go in and get a test, want to find out what's wrong. Went in, was greeted, had to pay. I paid for my test. Went to the back with a volunteer who was apparently a member of a local church. Took my pregnancy test, was a dipstick regular urine test. Was not allowed to see the results of the test that I took. I was told after less than a minute I was not pregnant. She said, "I'm really sorry to inform you." And of course, I was like beside myself thinking, I could have sworn that I was. Now, I have 2 other children, so I was familiar with all the feelings of being pregnant. She took me to a side room, and I said, "Can I see the test? Would that be okay?" She said, "No, I've already disposed of it." Okay. So she told me, she said, "Would it be okay if I prayed over your belly?" Oh, sure, I guess. So she prayed for about 15 minutes, and I just laid there on the table while she prayed over my belly. And she said, "You know, this really sincere prayer," and of course I was very emotional, not thinking I was pregnant and whatnot. So about 2 weeks later, still thinking something's not right here, went to my OB, just showed up, and I said, "Really, you have to see me." And went back and found out through a urine test that I was in fact pregnant. And I had been pregnant for about 12 weeks. So not only was I kind of blindsided by this information, thinking, oh, I knew that something was going on, but I was mortified that this clinic had told me that I wasn't pregnant. What if who knows what could have happened in this time? Knowing that I wanted to be pregnant told me that I was not pregnant. So I immediately went to my house, got home, emailed the executive director of this crisis pregnancy center, and I said, "I don't understand. You know, you told me that I wasn't, clearly I'm three months pregnant. I mean, I'm well over the first trimester." She said, "Well, these things happen. We use volunteers. We don't use medical professionals. A doctor is not able to see you at that particular CPC. I'm sorry that you had this experience. It's unfortunate, but I hope you'll visit us again." I have copies of the email if anybody would like to see copies of that. Now, of course, my beautiful 4-year-old, you know, a few months later, I had her and everything was right as rain, and she's growing like a weed, and I was thrilled. But just imagine, A, not being able to see the test that I took and it being discarded without me even seeing it, and then B, being told that I wasn't pregnant when in fact the test had come back positive. Now, I know you can have false positives and tests and this, but I was far enough along in my pregnancy that probably wouldn't have occurred. So I really hope that each and every one of you will see that, first off, we don't have any business using taxpayer funds in a religious organization. And secondly, if these crisis pregnancy centers cannot staff themselves with medical personnel, what kind of information are we giving to people? And this is coming from someone who didn't know anything about them. I did not want to get an abortion. I wanted to be pregnant. And very upset with the fact that I was told that I wasn't. Okay.
Ms. Anderson, thank you very much for
Thank
your
you.
testimony. I take that is that you're in opposition to the bill.
Very much so.
Thank you very much.
Thank you so much for your time.
Okay. Mel I'm sorry, I mangled your name. If you'll.
Mel Medallier.
Okay.
Hi, good afternoon to the committee members. I'm here sharing my testimony as a private citizen. I'm concerned about the import of this bill. I am testifying about my general perspectives on this bill, but my perspectives are informed by my legal background. I have a Juris Doctor from the Northeastern University School of Law, where my research focused on health policy and the social determinants of health, especially with regard to sexual and reproductive health access, international law, the human right to health, and non-discrimination and civil rights law in the U.S. I will get to the bill now, my perspectives.
You might want to put the computer lid down so we can.
Thank you.
Not having to talk over.
Yeah,
there
thanks.
We go.
So just a brief look at the bill language. 2 pieces that I wanted to bring attention to. The purpose of the grant program shall be to promote healthy pregnancies and childbirth by awarding grants to nonprofit organizations that provide pregnancy support services. And as it was pointed out earlier, this includes almost near comprehensive access to the services that one would hope that they would receive. So this includes, as you know, pregnancy tests, STI tests, health screening, etc. So all of these things are important. These are good things. But the bill stipulates that there can be no referral, promotion, or performance of abortions that will take place, which you referred to earlier, Madam Chair, but this betrays the underlying purpose of the bill. It purports to provide all of the information about resources that a woman might need at this critical point in her life, while excluding the legal option of terminating her pregnancy. So there's two issues with that. The bill excludes pregnancy termination information, which is one problematic aspect of the bill. And the second is that the bill specifically prioritizes organizations whose mission is to provide alternatives to abortion, which further highlights the issue. So I know I don't have very much more time, but I want to focus my remaining time on the power of the bill to mislead the public in the context of it, how it would actually play out on the ground. So when I read the section on promoting healthy pregnancies and childbirth, I have no disagreement with that. But the problem, which some of the members alluded to, is that this narrows the scope of how we're approaching women's health care overall. And this forecloses other options that we can consider, like prevention and comprehensive sex education with regard to improving the conditions under which people end up making these decisions. So a few questions came to mind as I was reading over the legislation. What about promoting healthy Georgia women and parents? We're talking a lot about everybody except for empowering the decision of the mother to have informed access to all of the information that she might need to make this very important decision. Secondly, making sure that women have all of the comprehensive care coupled with the education that they need long before a pregnancy even occurs. And I think we can ask, how would a pivot to this model of looking at care preventively and comprehensively, how would this truly support women in their need to make their own best decisions regarding healthy pregnancies? A healthy pregnancy would include access to information about how a woman can be safe and healthy leading up to the pregnancy, childbirth if she so chooses to carry the pregnancy to term, and childcare if she chooses to have the baby. One thing that came up earlier in the testimony is that was left out actually is that CPCs in other states, we've had the experience where CPC advertising has misled women. The advertising is very benign, and at a time when a woman is faced with convergent pressures and stressors on how she's going to approach this decision in her life. And because the CPCs under the bill would be free, as you mentioned, this would disproportionately impact who are underinsured and who are indigent, as the bill mentioned. So these are people that are going to be in disproportionately economically insecure positions who probably don't have the educational resources that they would need to make a fully informed decision. So I would say that all of the provisions I agree with, except for the fact that the glaring fact, which is actually the underlying import of the bill, which excludes the critical information about termination of pregnancy, which would be emphasized in practice in all likelihood, and would exploit women who don't know better because the advertising can be benign at best and misleading at worst. Thank you.
Thank you very much. I have a question that she brought up. I mean, I would take it that the clinics would be open and someone could actually come in, get a free pregnancy test and a free sonogram, listen to whatever you said, and then could walk out, since we have laws against illegal restraint, and I can't imagine you, on a lighter note, restraining and holding somebody against their will, especially for 9 months, but could walk out and obtain those services free, and then, if they so choose, go get an abortion and avail themselves to other services.
In fact, let me make this point. We have learned, again, there's 71 of these clinics, 40 that provide free ultrasounds. We are having women who are being sent from the abortion clinics to our clinics to get the free ultrasound, so then they can go back to the abortion clinic and have the lawful abortion performed within a certain week. So the women can leave and do as they choose. But if they choose to save their baby, then we can help them with those difficult decisions. How do I pay for a car seat? How do I get employment? How do I have a babysitter while I search for a job? Those are the things that this bill provides for.
Okay, and let me ask this question of the senator who knows much more about this issue than I do. I really haven't researched Planned Parenthood, but there is nothing to keep people at Planned Parenthood facilities in our state from making the same information about community services and how you get on Medicaid and get a physician. There's nothing that keeps them from offering that information.
That's exactly right.
And would hopefully they would do that if, at least to get some services or so forth, or if a mother was, even if she terminated the pregnancy, but the rest had other children and they needed to be and get food stamps or something, they would be available to tell that mother, even if she aborted the baby, that she could still avail herself of government services.
Right.
Okay. Rebecca Delhart, please. We've got another major bill.
All right, I'll be very quick.
And about this bill.
Okay. Thank you, Madam Chairman, members of the committee. I want to thank my representative who sits on the committee who actually asked me to be here to tell this story. I, too, went to a crisis pregnancy center, and I will keep it brief. It was actually when I was in college. I woke up. I had the worst pain I'd ever had before in my life. I called my mom, who worked at a healthcare facility. We weren't insured. I spent my entire life uninsured until I got my first job in Georgia. My family couldn't afford it. We decided it wasn't my appendix. It was on the left side, and she said, get to your university healthcare clinic. To make that part smaller, I went to the clinic. They said I needed to go to my primary care physician or that I needed to go to a hospital. One of my symptoms, one thing they were worried is that it could be an ectopic pregnancy. It was a Catholic university, so they weren't allowed to give us pregnancy tests. So they told me I needed to be on my way, but said it was very important and get to a healthcare facility. So I remembered seeing a place called the Northside Pregnancy Center. I went there, and it actually said free pregnancy testing, which was great. I was a college kid. I went in. I was crying. I had not ever been in so much pain in my life. I was in tears at the counter. I thought it was a medical facility, and I said, I need to see the doctor. I might have an ectopic pregnancy. I am terrified. I'm scared. I'm in a ton of pain, and they said, we'll be right with you. I was brought back. I was given a pregnancy test, a urine test. I was brought into a room where I was crying, and I still think back about how I don't know if I was more scared about what it was going to say or about how much this was going to cost my family to have to go to the hospital and perhaps have some emergency surgery or something. And I was crying, and I was asking her what was going to happen, and she said, she had put the test kind of on a shelf above my head, and she said, we'll get to your results, but I need you to look at some things first. And she gave me a series of pamphlets. I didn't understand what was going on. A lot of them were about things I was not there for. And it wasn't until I opened a baby announcement with pictures of fetuses on the inside that I kind of understood what was happening. I remember being so confused and angry and scared and didn't know if I was going to need an ambulance. She brought down the pregnancy test, and she said, no, you're not pregnant. It felt very judgmental. It didn't feel like I was there to be helped. And I felt very swindled. I thought it was a medical facility. So I say that to tell you, in the end, in case you're wondering, I had a cyst the size of an orange that burst on my ovary. I ended up calling my mom, one of the hardest conversations ever. I don't think I've ever heard my mom feel so guilty for being uninsured that I had been through that. So I got a train ticket, went home, got taken care of. I have a healthy child now. I'm very happy. That did not prohibit me, even though that ovary is damaged, from being able to have children later. But I say that because my concern is as the author said, these are meant to look like medical facilities. And for someone who's in crisis, you don't necessarily know that it's not a medical facility, and that is not where I would have gone had I known that. So I am concerned about state tax tax dollars going to fund these facilities. I am very lucky that when I was pregnant and I went to my doctor and confirmed that I did so under the guidance of medical professionals. That was about 2.5 years ago, and I have a beautiful baby boy. That situation, I believe, should be afforded to all women, this access with medical professionals.
Okay. Thank you very much. Okay. Sarah DuPont? Very short and to the point.
Absolutely.
Did I see Emory medical student on that?
Yes, my name is Sarah DuPont. Thank you, the Health and Human Services Committee. Thank you, Chairwoman Representative Cooper, for this opportunity to speak. My name is Sarah DuPont. I'm a student doctor at Emory University in my 3rd year. I'm here not as representative as Emory, but as a concerned future provider hoping to do family practice residency here in Georgia. I'm not here to give my opinion about abortion services, but express concern about the bill and its current language. The question of funding these pregnancy resource centers. As I learned to explain at the start of every prenatal care visit, I care about healthy moms and healthy babies, as I'm sure all you do too. To achieve that goal as a future medical professional, I'm driven by the conviction women need to receive the standard of medical care during the pregnancy, and this is why I'm opposed to the proposed Senate bill in its current form. According to the senator, they provide options counseling, sexually transmitted infection testing, ultrasounds, pregnancy tests that are, in other words, medical services. And if we're providing state money, then we have a responsibility to ensure the basic quality of those services. And what concerns me is there's no language requiring accurate medical information or requiring the presence of licensed medical professionals at these centers. Options counseling, pregnancy risk, sexual transmitted infection screening, these require medical training to provide information. And medical standards need to be accurate, research-based from trusted sources like National Cancer Institute, National Institute of Health. Furthermore, many of these centers, as has been mentioned, are providing ultrasounds to women who may be pregnant. Regarding that practice, I'd like to read just a very brief statement from American College of Radiology under practice parameters for performing and interpreting diagnostic ultrasound examinations. While no harmful effects of ultrasounds have been demonstrated at power levels used for diagnostic procedures, quality assurance dictates that it's necessary to use this imaging technique in the most appropriate and indicated fashion, and that ultrasound studies should be performed by qualified and knowledgeable physicians and sonographers using appropriate equipment and techniques. Examinations should only be performed when there is a valid medical reason. These parameters apply to all ultrasound examinations in all clinical situations. They should be supervised and interpreted by trained and qualified physicians. End quote. Again, this is practice parameters from American College of Radiology. And there's no requirement in this bill that pregnancy resource centers who will be receiving state funding have trained physicians reviewing these ultrasounds. So in conclusion, as I'm sure you're painfully aware, state funding for medical resources is very limited in Georgia. We need to be judicious about how we are applying it and who we're handing it out to, especially when we're discussing care for pregnant women. So if you're going to fund these pregnancy resource centers, please make sure that they meet the standard of medical care. That is, that there's a requirement for a licensed medical professional to be reviewing all of the medical services that are being provided to pregnant women, and that they provide medically accurate, research-based information so that we can ensure more healthy moms and healthy babies.
We have one more person, and they have to be brief. I mean, if we don't want them. Rula, and I'm not even go with the last name.
Madam Chairman, can I have the opportunity to close at the proper time also?
Yes. And you need to be very brief, or I'm going to lose my members, and I've got another bill.
I'm going to try as hard as I can. My name is Rula Abisamra. I'm a public health professional, a constituent of this committee, a taxpayer, and I currently serve as board chair of Access Reproductive Care Southeast. In all these capacities, I'm very concerned about this bill. I want to start by saying that maternity mortality rates in Georgia, especially among our most vulnerable folks, is one of my biggest concerns. For 10 years, I've had the privilege and responsibility of working with women who are pregnant. I've provided healthcare services, counseled pregnant women, and formally evaluated reproductive health programs. And unfortunately, my colleagues and I have worked with patients seeking abortion care who were more traumatized, more misinformed, more unsupported after visiting a so-called free pregnancy support center than they would ever be at an abortion clinic. And we've provided information on where to find safe and qualified abortion providers to women who were told there is no such thing.
Their experiences suggest that centers with an ideological agenda serve mainly to perpetuate stigma and shame in our communities. These patients are from nearly every county in Georgia, but basic medical care isn't available close to their homes. Sadly, most of the centers in Georgia that qualify to receive these funds do not provide the unbiased and comprehensive care they need, even though the bill uses those words. In actuality, the criteria void the very meaning of unbiased and comprehensive pregnancy care by specifically excluding one kind of decision and one kind of pregnancy care. Funding from the bill, according to the bill, can only go to centers that provide one-sided information and care, which inherently have an ideological agenda, although they may not call it a religious or political one, and although they may use medical costuming to further it. Most qualifying centers masquerade as comprehensive care centers, but don't give clients the full range of their options, and cannot, according to this bill, which not only limits what can be done with these funds, but who can receive the funds and what they can say at all. I'm also troubled by lines 26 to 29, I think. Concerning who will administer the grant, a contract management agency, it says, will be chosen to distribute the funds to service centers as it sees fit. Who chooses that agency? I would like to hear more about that. Who will they choose? Well, the administering agency must have the mission of encouraging childbirth as well, according to the bill, and it doesn't have to be a medical or health agency. Essentially, an agency with a one-sided agenda will be distributing taxpayer funds to centers with a one-sided agenda, and it could be the agency's own service centers. A similar bill in Florida resulted in exactly this type of conflict of interest. So I want to see the state close the huge gap in maternal mortality by supporting safe pregnancies. It's the most dire in the country, and it's over 3 times worse for African American women than white women. It's even worse for poor women and women who don't have insurance. Our community deserves to have taxpayer funding address our real needs. I would love to see a bill that can do any of this, but I don't think this bill is it. Real needs could include comprehensive sex education, Medicaid expansion, integrated HIV care. And I can tell you that the Women's Right to Know Act, although it provides plenty of information, does not offer resources for where to find all kinds of providers for pregnancy care. Only one kind.
Thank you. I take it you're against the bill.
I am against the bill.
Thank you. Okay. I have one question from the committee. I'm going to take it, and then I'm going to let Senator Unterman close, and then we'll go to the committee. All right. You're going to waive? Okay, no questions. All right, Senator Unterman.
Thank you, Madam Chairman. It's interesting to sit here and listen to this debate because it's almost like it's scripted. This is the exact same debate almost that we had on the floor of the Senate with the same arguments, except different people presenting them. The question was about who is the agency that chooses, what group chooses the agency that oversees this program. Is written into the bill that it's the Department of Public Health. We run many programs. I'm very proud of our public health department. The funding that we give to it is phenomenal. It's in every county in the state of Georgia, and I have all the confidence in the world of the Department of Public Health. The second thing I'd like to bring up that was brought up on the floor of the Senate is that there is no documentation of any lawsuits about false advertisements or the operations of these centers that I have been able to find. And if someone can find them and bring them forward, I'll be glad to talk about them and review them. But I can find absolutely no documentation of lawsuits that have been filed. There may be complaints, and when these people have complaints, I say this is great, because now we're putting in and implementing an oversight agency, and it's consumer protection. So when you do have complaints and you feel like you're not treated correctly, like these people have testified, that you'll have the option to be able to file complaints with the Department of Public Health. And they can be recorded. That transparency is there, that auditing is there, that reporting is there, and I think that's very important. So it's offering, if the center does opt into the program, it offers the consumer protection, it offers accountability, it offers transparency, and I think that's a good thing, and at the same time it's saving lives and the lives of babies in the state of Georgia, and we're reducing the 27,000 abortions per year in the state of Georgia, and I think that's a very good thing. Okay. Thank you for the opportunity to present this bill.
Okay, I'm ready to, okay, Representative Peake. It's a proper time. I have a motion to do pass. Second. I have second. Any further discussion? Representative Randall, do you want one last word?
No, I'm going to pass.
Okay. Any other discussion? Okay. Do you want to Would the opposition like a hand vote on this, or just the ayes? And you want a hand vote? All right. Everyone in favor of the passage to the substitute Senate Bill 308, raise your hand. Will the committee? Okay. Everyone in opposition? Okay.
Wait,
A minute.
can you raise them high again? 1, 2, 8, 9, 10.
Okay, the ayes have it, the bill passes. Thank you, okay? Thank you to the committee for staying with me. Senator Hill, you're up. Thank you, Senator Unterman.
Thank you. Thank you.
Huh? I mean, I just feel like Huh? Yeah. I mean, they were going to scream and yell at. You have Senate Bill 389. Can I get the committee's attention? Do we have the bill?
Yeah,
We do.
Which LC do you have?
Okay. We have LC 336592S.
That's right, Madam Chair.
That correct?
That is. Thank you.
Okay, this is a complicated bill, so can I have the committee's rapt attention on this one? Okay. Here, Senator, you've got it.
Okay. Thank you, Madam Chair, members of the committee. I know y'all have been sitting here a long time, so I'll try to be succinct. There's a lot of information here, but I'm grateful to be able to bring before you Senate Bill 389. Yeah, I think in government we often talk about and hear about a safety net, and you know, a safety net, in my opinion, sometimes entangles and holds people up, and I like to think of it more of as a safety trampoline, where when some of our most vulnerable fall down, they can bounce back up and grab the first rung on the ladder of opportunity. And just to interrupt myself, I'm joined here by Representative David Clark, who did a lot of work on the topics that we'll be discussing over the summer in a study committee, and he did an outstanding job on that. And some of the ideas are in this bill. But again, you know, we all in this state house and Senate want to help our most vulnerable and lift them up and move them from a position of being dependent into self-sufficiency. And that's what motivated me to get behind some of the merits of the bill that I will share with you. And hopefully that we can agree that, you know, and as I said on the Senate floor, everybody that will ultimately vote for this bill believe in the dignity and uniqueness and capacity of everybody who needs to sign up for SNAP benefits or TANF benefits. And our goal is to move them from where they are currently into meaningful work and to self-sufficiency. So let's just start with going through the bill. In Section 1, this is dealing with SNAP fraud. And what we're focusing on here is if one is repeatedly losing their card and asking for a replacement card, we want to just have the department sit down with them and interview them and at least have the flag raised that there could be some fraud, because a lot of times folks that are taking advantage of the system are selling their cards and then coming back and getting another one, and so this provision would at least look at that. The next one, 49-4-24, it's been great to work with the department. The folks that have implemented this program for our state, Ashley Fielding and others, are doing an excellent job, and I've been working with them on crafting the language around these reports. And because SNAP is a federally run program, we wanted to, knowing that the fiscal year of the federal government ends on September 30th, we want to give them, the department, 3 months. So on January 1st of each year, they're going to submit to us a report in the House and the Senate and the governor on the status of the program, and so it will cover the previous federal fiscal year. On page 3, we've changed the total lifetime of the benefits of TANF from 48 to 36. There is lots of studies that show that first of all, most families only use it for 12 months. But when you have a 36-month lifetime benefit, we believe it will help the culture of our team to focus on immediately moving that family from where they are to getting a job and moving on out of the need for being in TANF. So then going over to Section 4, page 5, we implemented a cash diversion program. This has been going on in many states across the country, where we're finding if a family comes down on their luck and they have a broken down car or something and that's preventing them from getting to work, then rather than enrolling them in TANF, which creates potentially a cycle of dependency, we can give them a cash benefit where they can go get their car fixed and then get back on their feet. The program is our staff here in the state is already doing a program somewhat like this, but it's not codified. So what I wanted to do was codify it and put some tightening language around it, and all that is laid out there. In fact, we call it a loan of sorts. So you get a loan if you need. If you pay it back, great. If you don't pay it back, you don't have to. It just counts towards your 36-month limit. So it becomes a benefit. But if you do pay it back, which a lot of people want to, it's a sense of integrity for them. And in other states, they found, well, we can't take it back. We don't know how to do that. So we want to put a program in Georgia that gives the recipient the dignity to return it if they're able to. If they're not able to, it's no big deal. It just becomes part of their benefit and will be applied to their 36-month limit. On page 6, we've implemented sanctions. Again, sanctions are already being done at the state level if the person on TANF is not doing a work requirement. This codifies it and it specifies it. And what this is it will say if somebody's not fulfilling their work requirement, they'll have 6 weeks to comply. They'll have a meeting with the department. If they do not comply in that 6-week period, they will be dropped from the rolls for 12 weeks. During that 12-week time, if they want to get back in line with the agreement that they made with our state to be part of a work requirement, then they can become back on the rolls. Page 7. This is, Madam Chair, excuse me, Mr. Vice Chair. I looked down, I lost her, so excuse me. There's and I appreciate the chair, Madam Chair, giving me a hearing only today because we want to continue to make this bill right, and we're working with all the parties involved to make sure that happens. One of the things we need to do is get rid of lines 206 through 216 because it's redundant. We've already covered the reports, and we don't need this particular piece. In Article 10, what we've done, we're back on SNAP fraud. We're basically codifying the areas that we want to be clear that a SNAP card is not eligible to be used for. And so we define what an applicant is. We define assistance as those, for the purposes of this section, are in the SNAP program. And we point out that if you're going to violate the terms of this program, then you're going to lose the benefit. That's what the 100% sanction is all about. And then we are also asking the department to report back to us on the status of a lot of these items. So the department shall conduct data matches using the name, date of birth. We want to make sure that the right arm is talking to the left in terms of our government on TANF and SNAP and these other programs. not to hinder folks that need this benefit, but to capture the folks that are taking advantage of this program that we have, and frankly, messing it up for all of us, because we often hear about voters in the public who lambast programs like this. And the reason that they do is because they fear that there's a lot of fraud, waste, and abuse. And so if we can tighten down on that, get rid of that aspect, and then truly help the folks that we need to be helping, these data matches will very much help with that. And then on page 9, these are some waivers that the federal government has offered to the state. And, some say it's to help with the stream of managing the program, and others might say it's the federal government trying to proliferate and expand this benefit to people who don't necessarily need it. And so what we want to do here is just make sure that the people that need this benefit are getting it, and that people that are able-bodied citizens and able to get out there and work, aren't taking advantage of this taxpayer benefit and when they don't need it. And so that's what those waivers are for, and we'll continue to talk with the department about how this would affect what they do. Starting at line 288, this is where we put in code the actual areas where SNAP cards should never be accepted. So, for example, alcohol, cigarettes, tobacco, bail, gambling activities, lottery tickets. Now, EBT cards you can't use them to do this anyway, but we wanted to put into code exactly what is explicitly prohibited in the event that, let's say somebody sells their card and gets cash from it and then uses it for this. Well, now they're liable and within our law of violating this measure. And then the last part, Section 8, and then I'm pause for questions, is the lottery. It's focusing on folks that get a benefit from the lottery of $1,000 or more, just reporting that to the Department of Public Health who's administering this program, because we want that to go towards their income if they've had a big windfall or whatnot. Not that $1,000 is a windfall, but that's the criteria that we've put. Any excess of 1,000. So that is the bill in full speed ahead, and I'm happy to answer any questions.
Representative Henson.
Thank you. Feel like I've been dealing with TANF for about the past 15 or 20 years that I've been here. I'm not quite sure. So I've got a few questions. Why do you reduce it from 48 months to 36?
Well, there's a couple reasons. Number one, we found in our studies, and again, that's why I brought David up here. And I got, Josh, tell me your last name. Archambault, who's also been helpful in putting this together in terms of data. But 12 months is about the max that people are on it anyway. But the main part is we want to, and for those of you who don't know, there is a 60-month maximum that the feds can allow you to do. And states have gone from anywhere from 21 months on the max up to 60. You can see we're at 48, and I'm bringing it down to 36.
Isn't this federal money?
It's a mix.
But the percent is what?
It's much higher Fed. It's a block. Yeah. It's a block grant program.
Okay, great. So how much is it costing the state by reducing it for 12 months?
It's not about money for me. It's about an incentive to move people from where they are to where they could be and should be.
But we also, in the previous bill we just discussed, we're trying to make sure that if a woman's pregnant, that she can bring a baby and have assistance and have help in the clinics, especially through her first year of life. And then we're looking that if by some chance she got pregnant again, she exhausted the 36 months, we're not going to give her any more food for the children that she currently has and the newborn that she's having in her house. I'm finding a contradiction between your bill and the Senator Unterman's bill. and looking out for the children of the state of Georgia. It's not just the woman. Understand, food stamps are for needy families, and there's children involved, and children that go to school hungry. So I have a grave concern with the punishment that we're meting out to the people. I know we've had an abuse problem, but I'm not sure that that's it. And then, we also say they have to be able-bodied and going back to work, and the 6-week thing. I had a car accident at the beginning of January. I'm telling you, I couldn't have gone and looked for a job for about the first 5 weeks of that. I was in too much pain. I was lucky I was coming up here every day and only doing what I had to do. I'm fine now, but that's thanks to some good medical care. And then I also want to bring up women also end up in abusive relationships. And cards can be stolen and things like that. And again, we're punishing. And I'm not even going to the, some of the others. I know you went back and you looked at the thing that I brought up about being injured in the 6 weeks. So let me see if I can find where I wrote that down. But there was a place where you said that they had to go look on employment and within 6 weeks or something like that, that they had to be doing that or they had to report. So those are just my concerns with this bill. I think that, it's Section 6, sanction 6 weeks to comply with the work requirement. And is there any exception to that?
Well, a couple things. You use the term punish, and that's not what my goal is. I mean, that's what you said we're doing, but we're trying to help these folks. And in my assessment of the situation, if a person comes in and they're thinking of the 48-month limit, that's sort of the wrong attitude that we're trying to adjust. We want them to be on hard times, and immediately we're given 36 months, 3 years to get on their feet and get a job and move forward.
It's not consistent, 36. It's 48. It's not consistent. You can have 36. You could have exhausted that and then end up with another child and need to be on TANF again. That counts. So you're saying that if a woman got pregnant again, and again, we're not pushing for abortions. We've had 27,000 in this state, so we're looking to lower them, but we're not willing to give food to the child. We're not willing.
This is TANF too, and so the provision you just mentioned, they could still qualify for food stamps.
Okay, TANF.
Representative Henson.
I'm sorry, I just disagree with where we're going with this bill.
Okay.
I think this is a hearing. I'll ask Senator Hill to look at some of your concerns with the department that administers those programs and talk to me about it.
Absolutely.
If there's a way to put a safety net exclusion in it. Who about that? Representative Mosby.
Thank you, Madam Chairman. Just quick question. In your testimony, you said TANF creates a cycle of dependency, and then you said that most people are on it for 12 months or less. How do you juxtapose those two positions?
I didn't say TANF creates a cycle of dependency.
I wrote it
was
down
saying that
while you was talking.
That benefits can, I mean, if some people are taking advantage of the program, and do you have an answer for that?
Yeah, I think that is why Senator Hunter Hill has asked him for the cash inversion fund. Diversion fund is because he's caring about the people who are truly needy. And I know when we went through the recession, you had a huge, massive majority of people across, the lower class, middle class, even the rich who did not handle their money right. So everybody, we hit, I think it was about around 70% of Americans in that recession at some time or another was living month to month, like paying the bills that they had to pay. So I think like with this cash diversion fund is something that Senator Hunter Hill and myself have a huge passion for, is to help people. Like, I hate the suffering. I mean, this is not to go save money to go spend it somewhere else. We have around 11,000 or 12,000 something men, women, and children who are on a waiting list to be helped here in Georgia, welfare, and they're not being helped. We have to help them. So the point is, we only have so much money too, and it's not about just saving money and just taking it back and go spend it somewhere else. It's to help more people who are suffering. You know, I mean, there's multiple people who I know who need better help and are not being helped because we need to get better at tightening some of these eligibilities so we can help the ones who are suffering. You know, single mothers, single dads, families who are struggling. So this is not to chase after them. And with the federal data is showing that on average, 12 months they're off TANF. So when you do 48 months, the people who do not need it, say, it's not everybody. I'm not chasing after saying that people don't care about people. But some are going, I have 48 months. We don't want that. Now, I'm all about, let's get them back on it if they hit another tough time. You know, I want to help them, and we should not leave them struggling. I mean, the Bible says help. We will always have the poor in the land, so we must help them. And I mean, I know that's my number one passion is to help them, but we can't be doing that if we're not tightening down some of these eligibilities, and with the cash diversion funds helping, and with like the EBT cards, was it losing the card 3 times? Let's have them come in. Let's sit them down, because what I saw on the study committee, you had just Maine alone was tracking some EBT card usage. They had in 2011, I think it was, 750,000 was used, swiped in Disney World. I've never been there. You know, so the thing is using that when the truly needy need it. Let's help them. I mean, that's awesome to go down to Disney World, go to the beach. Maine alone, that was 750,000 in Disney World. 3.5 million was used and swiped from Maine EBT cards. So I think it's cracking down a little bit. It's not cracking down the truly needy. It's helping them. They need it. I mean, I grew up, with nothing. I mean, my parents are well off now, but they worked a lot and saved, and we all saved as a family. I know one month we had $35, and my parents went and got a
That's because they had 20 kids.
Yeah. Well, yeah, exactly.
I'm only teasing.
Exactly. At that time, there was 3 kids, but they went $35.
And how many are there now?
10.
Okay.
They went and got a bag of beans and a bushel of potatoes and had that every single meal. Now, they probably should have went on and got some help. I mean, that's pretty tight. But the point is, so I want to help people. I want to help them. But by doing this, it's not going after the poor, because we shouldn't. That's not our...
Right.
Okay, Representative, you take a break.
Yeah, I was going to say, and I know Senator Hills is a great guy, and he wants to do the right thing in this. I was just asking a question around that. And the other thing is, can the department do some of this instead of us putting this in the code?
Well, and they are. That's why I said they're doing a great job currently, and we're making only a small change, a couple of changes to what they're doing. In a couple of cases, I've taken what they're doing and codified it. So the point is the answer is yes, but then that just is up to the governor, and if we keep having good governors, then it'll keep going well. But we have a good governor now, and so let's codify what he's doing in many cases, because it's good. And it also gives us some buy-in as a legislature into this very important aspect of our state government.
Okay. Before I lose more members, let me ask Mr. Archambault, are you local?
No.
Okay. Then I'm going to let you testify, if you will,
Thank you.
about the bill.
I will be brief. Madam Chair, distinguished members of the committee, thank you for this opportunity. My name is Josh Archambault. I'm a senior fellow at the Foundation for Government Accountability, which is a national think tank working on health and welfare issues. I do want to just speak briefly to this bill and the efforts in Senate Bill 389. This bill can do 4 things that I want you to remember. The first one is it does protect resources for the truly needy. It also can lead to better outcomes for the hundreds of thousands of low-income Georgians. It frees up resources for other priorities, and it saves taxpayers millions. Now, while we generally support what's in this bill, I do want to highlight just 3 areas very briefly that we actually think require strengthening, and from what I hear in the some amendments may be forthcoming in the version that you have, or it is in the version you have, excuse me. The first one that is not, though, is around eligibility determinations, and I want to highlight specifically for the Medicaid program, there is a proven reform out there that the state of Illinois actually passed in 2012 that allows your state in close to real time to figure out if somebody's actually eligible and then monitor throughout the whole year if they're still eligible. Let me give you one example why this matters so much in Georgia. As you all have moved to managed care in your Medicaid program, you want to know when somebody moves out of state immediately. Otherwise, you're going to continue to cut a check to the managed care company for the rest of the year when they're no longer living in your state. Unfortunately, under current rules and procedures, that does not happen as much as it should. Let me be very, very clear about what I'm talking about here. It's not a new IT system. We're talking about access to data. It's like a national credit check for your welfare enrollees. Your department is moving towards a new integrated eligibility system. I should warn, as we look across the country, and this is not a comment on Georgia, but just an observation around the country, those systems are usually late and over budget. And they don't live up to what I am talking about, which is the deeper dive and access to this data. Second, an area that is in the amendment that you're looking at has to do with work requirements for able-bodied adults without kids on food stamps. As the senator mentioned, this is a waiver that Georgia has taken, and the governor has slowly moved back towards re-implementing in certain parts of the state. Let me tell you why this matters so much. Since 2001, Georgia has seen a 1,181% increase in the number of able-bodied adults without children households on your food stamp program. Nationally, of this population, 75% report no earned income. That's trapped dependency. On average, we had a little bit of conversation around TANF, but on average nationally, people are on food stamps right now for 8 years or more. We want to make sure at least able-bodied adults without dependents are able to get back on their feet. And let me just highlight one example why this matters so much. We just worked on a project with the state of Kansas, the first of its kind. They re-implemented a statewide work requirement in 2013. And for the first time ever, we tracked what happened. 41,000 individuals came off the program, and the results were actually very promising. The first one is that within the first year, 60% were employed, and on average, for those that came off the program, their incomes went up 127%. Now, this is not a silver bullet, but it certainly is much better than the 93% of them that were in abject poverty before the reform. Finally, I'll just mention we had a conversation here about TANF penalties or sanctions. Georgia has arguably one of the weakest in the entire country. Research has shown that's been released this past summer that having a TANF program with clear rules actually can increase the marriage rate for certain individuals on your programs. It also leads to successful participation in the program. We understand that what leads to and makes people really hard to employ is when they have gaps in their resume, when they're not meeting a work requirement, when they're not volunteering or getting education or working part-time. That leads to failed participation on the TANF program in particular. That's why you need to focus on and have these clear guidelines, and many of them are included in the bill. In closing, I just thank you for this opportunity to share. FGA really stands to serve as a resource to share best practices across state lines. And let me just tell you, I think this bill is moving in the direction that's really promising for Georgia, but this is personal for me. I've seen the pernicious outcomes of welfare in my own family, and I would like to change that for so many individuals, not only here in Georgia, but across the country. Thank you.
Thank you. Anyone questions for the presenter? No questions. Thank you very much. Melissa Johnson, are you local? Local, so you can come back? Okay, thank you for that. Okay, we have a couple of questions. I'm going to cut it off at 4. Representative, you have something that you want to amend the bill with, right? In 2 sentences, what would your amendment do? And I'm going to ask members to take it with them.
All it does, it's a House Bill 847 that we just passed. All it's doing is putting welfare fraud in Title 16 in crimes and offenses. It's just clearing up some language.
Okay, So that'll be something we'll consider, but that was it. Okay, we have questions. Representative Fry.
Thank you, Madam Chair. Senator Hill, what do y'all have any figures on if we're actually losing any of the federal match by reducing it from the time limit or the money that we're spending from 48 to 36? I mean, I know we're trying to save money. I get that. I mean, I think you guys are doing the right thing and trying to be fiscally responsible with stuff. But are we leaving money on the table?
It's a fair question, and I don't know, but I do know members of the department are here somewhere, and they might,
Ashley?
They might know.
Well,
Would that be something that we could get?
Can you
information
comment on
to?
it? Tell us who you're with and or who's going to speak to that.
Madam Chairman, members of the committee, I'm John Anderson. I'm the Deputy Division Director for DFACS, and I'm over the eligibility programs. And the question was, would we be leaving any federal money on the table? TANF is a block grant, and states are required to put a maintenance of effort a piece into it. So the block grant is usually determined by the number of people that are potentially eligible in your state. So the short answer to your question is that when they reevaluate the population again, we could have our block grant reduced.
So it's not determined, being a block grant, a follow-up question? Sorry.
Yeah, sure.
So it's not determined by the amount of money that we put into the program.
No.
It's just determined by the eligibility. And so if we reduce the eligibility of the program, we will be helping less people.
That's a difficult question to answer, so I wouldn't want to say definitively on that one, because you still have those people. It's the question of, do you get all the way through what they need in that 36 months? When if you had another 12 months, could you have helped them a little bit help them a little bit further along the line?
Right. Thank you.
Okay, I have a question. We say that we have people that need services. Are there people waiting that if we did 36 months, it would loosen up funds for us to take more people that need it?
I'm not aware of it. I know you spoke to a waiting list, but I'm not aware of a waiting list in TANF. Now, child care, sometimes there's a waiting list in child care, and I know in the Medicaid waiver programs and Medicaid, the adult community service programs, there are waiting lists on that, but TANF, we don't have waiting lists.
Okay, and that money is not interchangeable?
No.
Okay, thank you. Did Representative Fry, that answer your questions? Okay, Representative Gordon.
And I guess I'm sorry, Madam Chair, my question was more past speaker centrific. I know that I feel like maybe around 2 or 3 years ago, there were some changes in DFACS as it related to the EBT access, or I guess the re-enlisting that the families or individuals had to partake in from a renewal standpoint. I'm assuming that was maybe like every 12 months. And I know that I just got inundated with calls from folk who actually had gone through the process, and I guess it was at a point when we were short on staffing, and I had to intervene numerous times to get people who were still within their time frame re-enlisted or back activated their EBT benefit. And so I'm just, I guess, curious to ask that if we re-regulate or add in new procedures, is that going to be a need for additional staff on the DFAC side to I guess almost in essence, I don't know if police it or administrate it is the right terminology, but I know that when we changed the regs about 2 or 3 years ago, there were a lot of families that unfortunately were still within their access to EBT that went without, and I would be remiss to say that without intervention from other folk would not have gotten anything. And so I'm just asking, from the intent standpoint, does this put any other, I don't know if burden is the right word, on DFACS officials that are obviously already overworked?
Let's ask that question. I think we got it. Okay. Ashley, somebody stand up.
My apologies, Madam Chair. To Representative Gordon's question, he is speaking specifically to a change in the process for determining eligibility for food stamps that occurred back in 2013, 2014 timeframe. If I can make a bit of a description of what it was like, the process was changed to more of an assembly line of determining eligibility. This decision was made during the recession when eligibility for the program exploded. There were more people that were eligible for the programs. However, DFACS, along with all other state departments, had a cut in funding, had fewer staff to help process those applications.
But I think what he's asking, if I can just cut you short because
Sure.
we're going to quit, is he's asking if this is implemented, are you going to need a whole lot more staff and is it going to be a big implementation process?
There are some issues in the bill that would require additional procedures for our eligibility staff. That would slow our determinations of eligibility, especially at least in the interim. The second piece of that is the development of the integrated eligibility system. Right now, we are moving toward an implementation of that new system, and any changes to our policies in that system would be costly and would slow the development of that system.
Okay. Would you discuss that? Okay. Or Senator?
Thank you, Madam Chair. And one of the things we wanted to do in working with the department is we originally had dates like January 1 of 2017 and even July 1 of 2016 in terms of implementation. But if you'll note in the bill, we delayed implementation for a whole year to give the department the chance to ramp up and deal with these changes.
Okay. Last question. Representative Wilkinson.
First of all, I thank you all for all your hard work on this. This is what we're about. And, you know, I'm a policy wonk, so I just love this. And I appreciate the care and all the concerns and the fact we're trying to help Georgians. And, Madam Chair, I do have one observation. Okay. As you know, Senator Hill is a graduate of the United States Military Academy at West Point.
Oh,
but let the record show, in his presentation he used a naval term. It's about time, full speed ahead. So.
Okay. You know, we're down into crunch time. So I've been able to get the room for Thursday at 2 o'clock. I'm trying to get it at 1:30. There's somebody in front of us. We only have an hour on Thursday. If I can get it for 1:30, I'll move us to an hour and a half. I know Senator Hill is going to work on this with the DFACS representatives, and any of you that have questions for him. Time is of the essence, but we want to get this right. I wish you would take home the bill and also the representative's amendment that you've got. Look over those. The bill will change, I'm sure, some, but at least you have a foundation of that before you come back. So with that, Senator, will you work with them? And we are going to be at a time bind, so if possible tomorrow, y'all can work this out, Ashley, in your department, so that hopefully we can get a sub early. Okay, and also if we could go ahead and just have the representative's bill incorporated into one sub.
So you want us to go ahead and do that?
Yes.
Okay, very good.
If you would do that.
Excellent.
Okay? Because
Thank you
it passed
very
our
much.
committee, right? Or passed the House. And so if you just incorporate it into one
Absolutely. No
bill.
problem.
We are adjourned. Thank you very much for the members that stuck it out with us. Thank you.